In the Highlands, we've been working hard to reduce sepsis deaths in hospital for many years. We believe that preventing deaths in sepsis relies on three things. Firstly, a simple definition to allow all staff to recognise patients at risk. Secondly, an easy-to-follow management plan which is supported by senior staff. And thirdly, good teamwork to ensure that things are done swiftly. We invented the Stop, Think, Act strategy to help frontline staff to deliver sepsis care. Our first goal must be early recognition, and we have simplified our definition of sepsis to aid this. In NHS Highland, we have quantified our definition as a news of 5 or more due to probable infection, but there is freedom to apply sepsis management to anyone who appears significantly unwell, even if they don't meet the strict criteria, and to withhold treatment where an experienced clinician judges that the abnormal physiology is not due to infection. We use the phrase time zero to mean the earliest possible time that we could start to intervene. This is usually the moment a person arrives in our care, or the first time we record a significant deterioration in their physiology. We then try to deliver the initial sepsis management as soon as possible, and certainly within 1 hour of time zero. Most people are familiar with the sepsis 6 as the things we should deliver within the hour. To recap briefly: 1. Oxygen should be given when the patient is hypoxic. 2. Blood cultures are fundamental in helping to guide treatment and are much less likely to be positive after antibiotics are started, so early, correctly taken blood cultures are a must in hospital care. 3. Intravenous antibiotics are the cornerstone of sepsis management. Use the quick guide to help make rapid decisions, but always check for any previous results that may guide therapy. If in doubt, seek advice. 4. Lactate. Any elevation in lactate signals that your patient is potentially very unwell. When the first lactate is elevated, repeat ones should be measured to show whether there is improvement or further deterioration. Venous or arterial blood gases give instant results which guide therapy. 5. Fluids. Rapid use of IV fluids in anyone who is hypotensive, tachycardic or with a raised lactate can arrest deterioration, and we have a patient group directive which allows 500 ml of fluid to be given before a prescriber is available. A patient may need much more than this, although senior review or advice is appropriate when someone has not responded to the first 2 litres of fluid. 6. A fluid balance chart should be started as early as possible, and a catheter considered if the patient is hypotensive or there are concerns about poor urine output. If staff remain concerned, you should feel confident to get senior help at a very early stage. If we follow these simple steps, we will be providing excellent care to every patient at risk from sepsis.